More spending cuts are expected soon at City Hall. Mayor Mamdani ordered every agency to find savings of at least 2.5% ahead of next year without reducing services or cutting jobs. And this comes after the Mamdani administration delayed health care payments for retired city workers until December. Joining me now to talk more about this is Marianne Pizzitola. She's the president of the city's Public Service Retirees Organization. Thank you for coming on.
Thanks for having me.
So tell us what you would like to see done differently by the Mamdani administration. I know you've been trying to meet with them. What's your main ask?
Well, we've been trying to meet with him since he became a mayor in office, and we're trying to get him to meet with our organization about our retiree health benefits that were promised to us. So far, we've been met with silence, and he's not willing to speak with us for whatever reason.
And where do those benefits stand for you right now, for your organization?
Well, the decisions that were made have put us into an affordability crisis. Decisions are being made by mayoral administration, Office of Management Budget, Mayor's Office of Labor Relations and prior mayors, and of course unions that we're not in any longer, that were meant, I guess, in their view as a cost savings, but it was literally a cost transfer to these elderly and disabled retirees, including 9/11 responders, survivors, and widows, and it's put them in a financial crisis.
Do you have a concern about Mamdani delaying the payments until December for this fund?
Yeah, so the Retiree Health Benefit Trust was created under Mayor Bloomberg and former Speaker Christine Quinn, and it was not to be used as a budget, fungible budget item. It was meant solely to be used for retiree health benefits. Health benefits are not funded like pensions are. Pensions are invested and their money are put into them, and there's controls about, how they're spent. There is nothing like that for the Retiree Health Benefit Trust, and that is a concern because the mayor borrowed against it to fill whatever budget gap that he was having or a cash flow issue, as it was explained last week. And this is a problem because the city keeps doing this, is literally trying to solve budget issues on the backs of retirees. And we ran this city, we built this city. After 9/11, we rebuilt this city.
And we're talking about roughly 250,000 retirees,
yes,
who rely on these health care benefits.
Yes, and being met with silence instead of leadership. I mean, he could disagree with me, but he at least should have the courtesy of a conversation with me.
Yeah, okay, so say you were to have that hypothetical conversation. Yes. Talk about what your main asks are, given what you just described happening with this fund.
Well, the fund was designed to pay for healthcare benefits, what they call OPEB, other post-employment benefits for retirees. And we want him to speak with us about not using that money in a fungible way. We want him to be able to understand why it's important to us, because whenever there's an issue like this, they keep looking to retirees to fill a budget gap, and that shouldn't happen. We're mostly low-income retirees. We were made a promise of our health care. We should not have ever had to fight to be not forced into a Medicare Advantage plan. Cost transfer.
Are these concerns exacerbated by cuts at the federal level?
They are in a way, but our benefits are provided by the City of New York, and we're provided with a reimbursement, but the city doesn't give us that reimbursement for 16 to 22 months.
Has there been a real impact on retirees at this point, or are you sort of gaming it out as to what might come?
No, this is real. We have retirees that are in affordability crisis right now. I have retirees that are going to food pantries or who are not going to the doctor, even chemotherapy, because of the cost transfer that was given to us in the form of copays in 2025 that literally is charging them for every doctor visit, test that they have. And if you have a $25,000 pension, you can't go to a doctor, let's say for chemotherapy 2-3 times a week, and get hit with copays that are $65 that we never had in the 60 years that Medicare has been around. So this is a direct cost transfer, putting low-income retirees in an affordability crisis, and that should be something the mayor is passionate about.
I mean, if there was one change that you would ask him to make right now, what would it be?
Roll back the copays that were implemented in January 2025 without ever having spoken to us.
Marianne Pizzitola, president of the Organization for Public Service Retirees. Really appreciate your coming on the Rush Hour.
Thanks for having me.
Absolutely.